Hi everyone, I'm Dr. Sneha Anna Joy, consultant nephrologist at Believers Church Medical College Hospital, Kerala. I'm also in the social media team for the third National Conference of Women in Nephrology India, WinICON 2024. Today, I'm excited to have with us for the pre-conference interview Dr. Anushree Shirali, a brilliant and outstanding alumnus and academician from the Yale School of Medicine. She is the medical director for both the hemodialysis and peritoneal dialysis unit at Yale. She is also the head of the Onconephrology Specialty Clinic. She has served on the American Society of Nephrology's Onconephrology Advisory Group, has contributed to the American Society of Nephrology's Onconephrology curriculum, and is on the editorial board of the Journal of Onconephrology. She'll be taking a special session on nephrotoxicity associated with cancer immunotherapy for WinICON 2024. Without further ado, let me present to you Dr. Anushree Shirali. Ma'am, we are so happy to have you with us here. Your niche area of onconephrology is very unique. We would like to know what inspired you towards this.
Well, thank you, Sneha. It's such a pleasure for me to be here with you today. As far as onconephrology goes, I joined the faculty at Yale around 2011. It was around the same time that our cancer hospital, the Smilow Cancer Hospital, was being built and expanded. And so there was really a ripe opportunity because there were a lot of patients from that hospital who needed care when they developed kidney disease. Adding to that, I had personal experience with cancer in my family, and both in my father in particular. And so the idea of being able to provide kidney care, something that I'm quite passionate about, to patients who have cancer, who are so vulnerable at a very particular time in their lives, was very appealing to me. So that's really how I got started in it.
It's so nice to hear that you have such a personal story around it, and you're able to give personalized care for all these patients now. We understand that you have particular interest in immune checkpoint inhibitors and their kidney-related adverse effects. Can you tell us what advances have come up in this area?
Sure. So, the story of the nephrotoxicity of these drugs goes back to around 2014, 2015, somewhere around that time. And that's really when the clinical trials were in full swing in the United States, and these drugs were heading towards approval. And we had 6 cases at our own hospital that we ended up publishing of 6 patients who developed acute interstitial nephritis. Since then, while they were on these checkpoint inhibitors, since then there's now been a plethora of evidence that there is a risk of developing acute kidney injury, particularly acute interstitial nephritis, with the use of these drugs. It's not a huge risk. It doesn't mean that everybody who's on them gets it. It's about if you look at across all the trials, and depending on what drugs you're on, about a 4% overall incidence of AKI. And in terms of what's happening in the field and advances, it's not so much about treatment, because these tend to be steroid responsive acute interstitial AKIs from acute interstitial nephritis. But I think what we're now seeing are ways of, for example, non-invasively diagnosing people. I think that's going to be the biggest advance, and there's a lot of work being done in this area. My colleague at Yale, in particular, Dr. Dennis Melodina, is looking at the use of urinary biomarkers to non-invasively diagnose AIN, for example, using different cytokines. One of them in particular seems very promising, CXCL9. Dennis has published this in the Journal of Clinical Investigation over the last couple of years. So I think that's very interesting. And then, the idea of re-challenging patients with these drugs, because it can be pretty heartbreaking when you have to say that, the acute interstitial nephritis is from immunotherapy, and then there's a pause, at least in the treatment. But, overall, when you re-challenge patients, it's about a 15% recurrence rate, which is high, but not, as high as one would think. So, it'll be interesting to see if we can tease out which patients are at higher risk, for example, for developing recurrent AIN. And I think looking at urinary biomarkers not only to diagnose patients, but also potentially to see if these urinary biomarkers can predict recurrence will be quite interesting.
So we can probably make sure that they don't get an AIN even before they get it, like
That's
with the
right. I
drugs and
think
with the
Dennis's hope is if
biomarker.
you can, absolutely. And I think Dennis's hope is that if you can prospectively follow people's urine levels, that maybe you could predict if they're at risk for developing AKI and AIN in particular.
Your special session at WinICon 2024 is awaited with eager anticipation. Can you give us a glimpse into your talk?
So I'm going to talk about the two different forms of nephrotoxicity. So the one I think many, if not all practitioners of nephrology in India are now familiar with is the use of immune checkpoint inhibitors. So we'll talk about that. But I'm equally excited to talk about chimeric antigen receptor T cells, which is a different form of immunotherapy relying on some of the same immunological principles to treat cancer. And I'm particularly excited about this because India now has CAR-T. My understanding is that there's a biotechnology company in Mumbai which is spearheading the efforts to bring it to India, which I find very exciting. And so I'll talk about how these patients present and potential treatments. So that's really sort of a snapshot of the talk.
We have a lot more questions for you, actually, ma'am, but we don't want to take too much of your time. And we'll keep it for the talk as a special part of the talk. So you've been so inspiring, ma'am, and it has been such a privilege to talk to you and hear about the cutting edge research that you're into. So we thank you so much, ma'am, for going out of your way and finding time for us. And we are eagerly awaiting your special session at WinICon 2024.
Oh, thank you so much. It's a pleasure for me.
For the viewers, please note that this talk on nephrotoxicity associated with cancer immunotherapy is going to be on the 3rd of August 2024 in Hall A from 4 to 4:30 p.m. So see you all at WinICon 2024 at Mascot Hotel on August 3rd and 4th. See you.
Thank you so much.
Thank you so much, ma'am. Thank you.